I'll bring on our next guest, Brittany, who really specializes in dealing with Black maternal health. And she did her research into, I think I put out 15,000 calls for people to help me with this specific topic and could not find anybody. But I just want to give a shout out to my friend Indira, who connected me with her sister. And Brittany's going to come on and talk to us about these issues.
All right. I'm just excited to hear what Dr. Brittany is going to tell us about this topic.
All right, so I'm going to add her to the stage right now. Brittany, we're so excited to have you on. You see, I gave you a whole monologue. Dr. Brittany Case, she's a family nurse practitioner and health equity advocate. Brittany is going to really talk to us about Black maternal health. You heard the reason why I really decided to organize this event. And again, it's not about somebody, a political statement, pro-life or pro-choice. It's about treating people with respect. That was racist. I mean, it was racism, right? You know, you literally, you can hear the videotape where the nurse calls and literally flips the story on this young lady, and she ended up in jail. Trauma on top of trauma. So with that, let's jump in. Brittany, you tell us a little bit about yourself, what inspired you to get into this line of work, and then, you know, honey, just start sharing with us the facts about Black maternal health.
All right. Good morning. Thank you, Dr. Taylor, and thank you, Coach Angela, for having me. I'm very excited to be here. Black maternal health has been something that I've been passionate about for years. As a RN, I worked high-risk maternity care, and 90% of my patients looked like me. And our patients were sick. I mean, many patients who passed away, patients who, were there long-term, their babies were in the NICU. So it was just something that sparked a passion in me. Furthermore, I had my own daughter, and I remember feeling really unsafe with my nurses. I actually did not feel safe until after I had my baby, and there were nurses who looked like me who were taking care of me. So it was a long period of time where I didn't feel safe. And I was a nurse at the time. And so I was very uncomfortable. And then finally, when I had someone who came in looking like me, I felt a sense of relief. And I was like, okay, I'm going to be all right. Someone looks like me. They're going to take care of me. I'm going to be safe here. And so just over the years of encountering patients and listening to patients' stories, Kira Johnson, who is Judge Hatchett's daughter-in-law who passed away several years ago, her story really impacted me. You know, here's this professional woman who, had no real comorbidities, and she passed away because the healthcare providers did not listen to her because of unconscious bias. And that's a lot of what the research is telling us now that affects Black maternal health and the mortality rates. We do know that the mortality rates for African-American women and non-Hispanic Black women are 3 times that of their white counterparts. And that the statistics are staggering, and they just continue to increase. In fact, since 2018, the statistics have increased almost 3 times across the board for the entire country, but they continue to be higher for Black patients. So, we do know that racial bias has a huge impact on our patients' care and their health. And on top of that, Black women and African-American people, we tend to have more comorbidities. We're more likely to have pre-existing cardiovascular disorders. We're more likely to experience adverse pregnancy outcomes that then put us at risk for cardiovascular outcomes and cardiovascular disease. So, this is definitely an issue that we need to combat. It's not going to take anyone else to do it. We have to do it as a community. We have to combat this ourselves.